Hello everybody, myself Dr. Sumit Agrawal. I am a consultant plastic and hair transplant surgeon practicing at Harley's Clinic in Mumbai and at Zuleika Hospital in Dubai. Today I would be discussing a very common topic which is quite hot nowadays, is hair loss happening in early youth. It is quite common nowadays to see that hair loss starting in youth in early 20s. We now quite regularly see a lot of patients coming in the 18 to 20 year age group with starting of the hair thinning and receding of the hairline. The parents are quite anxious about the early loss of the hair loss. We've generally seen that it happens more in families where there is a history of hereditary hair loss, where although the father or the uncle may have lost hairs at an age group of around 40 to 50s, but in the younger generation, in the kids, it has started at an early age group of 20s. Probably it is more because of the unhealthy lifestyle and pollution, environment, stress of studies and junk food. So in these cases, we generally advise the patients, the families, that the child should be eating more of, should have more of homemade food with more of protein and eggs. You should avoid junk food, and even multivitamin tablets can be added to compensate for the micronutrient deficiency. The oiling and shampooing has to be done regularly. Better avoid spa and other these hair care procedures and all, and even meditation and pranayam regularly can help in slowing down the hair loss. But ultimately these children may become a candidate of hair transplant if the hairline has receded significantly. So in those cases, they may ultimately require a transplant. But we generally do transplants only once they have crossed the age group of 20 to 21 year age, and only after fully considering their age of start of hair loss, their familial pattern of hair loss, the medical history of the treatments they have taken for the hair loss, and what are their expectations from the hair transplants. All these factors needs to be considered if we are planning for a hair transplant in an early age group. In hair transplant, there are basically two techniques, the FUT strip technique and the FUE technique, which is also known as the DHT technique. In these young generations, it is most of the time it is just frontal hairline restoration. So it's a small session. So we generally prefer FUE, the without stitches technique, for these small sessions of covering the frontal hairline. It's more friendly, less invasive, and the recovery is comparatively faster compared to the earlier FUT, the strip technique. It is a simple one-day session done under local anesthesia. You come to the clinic in the morning, you walk out in the evening, take rest for 3, 4, 5 days before resuming the college or the work. And these transplanted hairs, they take some time to grow. They start growing in 3 months. You see good density in 6 months and complete result in 10 to 12 months. So it takes almost a year to get the complete result. And even after the transplant, they still have to continue the multivitamins and the medicines to maintain the existing hair for the long term. So this is all about the hair loss in the early youth, which we are facing quite common nowadays. If you have any more queries or any more doubts, you can write to me on Lybrate. Thank you.